Everybody, my name is Mike Sheehan. I am the Communications Director at the Hennepin County Sheriff's Office. I want to thank you all for coming. We're going to have a presentation on the status of opioid addiction crisis in Hennepin County. We'll cover that for about a half hour, and then we'll shift into questions and answers. Right now, I'd just like to introduce Sheriff Rich Stanek. Sheriff Stanek is a 34-year veteran of law enforcement and has been serving as the elected sheriff of Hennepin County since 2007. And we're just going to talk about the current state of opioid crisis, what's going on in Hennepin County, and what we can address it as a community going forward. So without further ado, Sheriff Stanek.
All right, good. You guys in a good mood tonight? We've done a number of these things over the last year and a half. You know, sometimes we end up 300-400 people, other times we end up with a smaller group. Nonetheless, you know, each and every time people walk away with a pretty good understanding about what the opioid crisis is and how you might play a role in all this in terms of prevention and intervention, resources. Our panel tonight is dynamic. Many of them have been with us before, and they're going to make it easy for you because they want to hear from you. This is interactive, right? It's going to take me about 15 minutes or so to get through my part, but I'm going to set the stage. And then we're going to turn it over to these folks. They're going to talk a little bit from each of their different perspectives, law enforcement, educators, other resources available to you. And then we want to hear from you, and you can have a little interactive dialogue. Make sense? Okay, well, let me say this. So I'm absolutely honored to be here. I love coming out to the different groups and community centers and schools around the county, and I consider it a privilege every day to work on your behalf as your elected sheriff. I want to thank the school district and the city of St. Louis Park for hosting us here tonight as we discuss this critically important topic. And I wish to extend personal thanks to the superintendent of the school district and Ms. Kim Fisher from St. Louis Park School District, Paul Bierhaus, who's here with us tonight. He's a member of our community advisory board. It was his idea to come on out here and work with folks. And of course, Ms. Jackie Larson from the city of St. Louis Park as well. Joining me on stage tonight, our panel, as you're going to meet him here in a little bit, but I'll just do a quick introduction for all of you. Chief Mike Hersey from the St. Louis Park Police Department. Mike's got a tough job every day, and Mike does a phenomenal job every day, the men and women who work at the St. Louis Park Police Department. He's one of our law enforcement partners, and he's passionate about what we do. Dr. Steve Delici is the Assistant Dean at the Hazelden Betty Ford Graduate School of Addiction Studies. Ms. Holly Magdance has been with us before. She's the coordinator of the Hopkins Public Schools Hopkins One Voice program. And then Ms. Rotem Michael, chair of the Hopkins One Voice Coalition. And as we're going to soon hear, she's someone who has some firsthand knowledge of the devastating effects of this opioid crisis. And Special Agent Jeff Vaness from the FBI. He's the Minneapolis Chief Division Counsel of our local FBI office. And Assistant U.S. Attorney and a good friend, Annie Dunn, who leads the Organized Crime Drug Enforcement Task Force section of their office here at the U.S. Attorney. I brought some slides because I want to bring it to life for you. We created this hashtag Overdose campaign to accomplish the goals you see here. Number one was to raise the awareness, two was to build partnerships, and three was to reduce the number of deaths throughout Hennepin County. Throughout 2017, just a couple months ago, we ended the year. We were actively engaged in this comprehensive effort to reverse the trend of rising overdose deaths. Everyone has a role to play. Again, it doesn't matter what segment of the community you come with, whether you're a parent, a student, maybe just somebody who's interested in what we had to say this evening. This hashtag Overdose campaign truly is a multi-level approach to reducing the number of opioid-related deaths across Hennepin County. And what we see in Hennepin County is the same thing we see across the state of Minnesota. It's by no means magic to Hennepin County. We're just one of 87 counties. We happen to be the largest. And then if you look at it not just on a statewide level, but national level, the same trend. Many counties, many states across this country are feeling the same effects we are from opiate overdose addiction. Investigations and enforcement are what you expect out of local law enforcement, right? We do it well. Sometimes we do it too well. But that is not purely not the answer to all of this. We're going to continue to conduct town hall meetings and events like this across the county and throughout the year. We're going to partner with organizations like the Hennepin County Medical Center and North Memorial, the Steve Rumler Hope Foundation, the public schools, the police departments, our first responders, and other organizations as they come forward in order to change this trend. We're going to be working with local and state governments to ensure that policy matters that can affect the number of opioid-related deaths are also being addressed. Now, you may have noticed maybe some of the digital billboards around the county. I think we have 16 of them now that we use to change the messaging, and we do so in order to better inform the public. We're expecting them to be seen by over 4 million people over the next several months of 2018 here, as we did in 2017. Look, folks, this opioid crisis is some scary, scary stuff, right? I bet, in fact, I'll just ask you, how many of you have friends, relatives, nieces, nephews, aunts, uncles, neighbors down the block, maybe employees or employers who have had some addiction issue? Yeah, a few? We all have, right? I've had it. Our deputies, people out in the audience have had it. I've been in law enforcement for 34 plus years, and I can tell you this is the kind of stuff that keeps me up at night. Why? Because like I said, every single one of them is tragic, but every single one of them is preventable. In 2016, think about this, Hennepin County saw 153 opioid-related deaths. In 2017, the Hennepin County has seen at least 162 deaths, and we're not even done counting out the year yet. Like I said, over those last 2 years, in 16 and 17, a 47% increase in this thing. And, you know, is it going to stop here in 2018, 2019, 2020? I don't know. But I know folks like the panel and all of you make a difference at the end of the day, and it's by sheer and pure education that we can make a difference. People ask me all the time, Sheriff, is this a crisis? Well, what do you guys think? If I had 162 homicides in my county last year in 2017 versus the 65 or so that I did have, again, we run about 3 times the number. What would you say to us? What would you say to law enforcement or the U.S. Attorney or the FBI or to the Sheriff of the county? You demand more, right? You absolutely would. That's a lot of people. Too often we look at these issues like this as someone else's problem, right? It's the neighbor down the block. Well, it's not my kids, it's my sister's kids. Or, you know, hey, I'm an educator, I'm a doctor, I'm a business person, it's one of my employees, they've got to figure it out. We all have a role and a stake to play. And these partnerships we built to conduct the hashtag #NoVerdose campaign have been far-reaching. We've worked really hard on this. We have a coalition of concerned citizens that include academics, current and retired law enforcement, educators, public school employees, community public health advocates, recovering addicts, and parents. Now, you name it. They come from all segments and gamuts across the county. The Hennepin County Sheriff Foundation has been a strong source of material and financial support to us, and all 4 Minnesota pro sports teams have agreed to help get the word out about the opioid crisis. The Minnesota Twins, the Minnesota Vikings, the Minnesota Wild, and the Minnesota Timberwolves and Lynx. They have all stepped up to help us. There isn't a piece of this that we have left out. But nonetheless, those numbers last year and the year before, 47% increase. And not to be overlooked in any way is the natural partnership the Sheriff's Office has with the other 86 county sheriffs across Minnesota. Like I said, what happens in Hennepin County isn't isolated to Hennepin County. There's 3.5 million people in this metropolitan area and about 5.5 million people across the state of Minnesota. During our annual Minnesota State Fair, we partnered with our 7 county metro area sheriffs to staff our booth. Some of you, Paul and others, were out there working with us as well. More than 1 million visitors came to Minnesota State Fair, and tens of thousands of them stopped by our booth, whether they're from Hennepin County or Ramsey or Couchiching or Yellow Medicine, whatever it was. They came by, and we helped educate them a little bit about the hazards of opioid overdose. These drug deactivation pouches are another easy and effective way to dispose of unused medicines. If you ask your pharmacist when you go next time to Walgreens or CVS or wherever it might be, ask them if they carry them, and if they don't, ask why not. About 70% of drug abusers swipe pills from medicine cabinets of friends and family. Did you hear me? So this is one of the questions I'm going to ask you in a little bit. So I'm giving you the answers to my quiz. I told you there's a quiz tonight, right? Well, there is a quiz. It's better to tell you now than later, but I already gave you a couple of the answers to the quiz. So that's why I hope you're paying attention. You think about, there was a law passed back in 2016 that allows you to take these medicines back to pharmacies, but so far in Hennepin County, only 3 pharmacies have added to take back boxes, right? There's a Walgreens over on Blake Road out here in Hopkins. There's one out on Brooklyn Boulevard in Brooklyn Park, and there's one over on 45th and Hiawatha in Minneapolis. 3 pharmacies out of how many across Hennepin County? 500, 1,000, right? There should be more. And you, as residents of this county, should demand more of these folks, and I hope you do. You think about the Hennepin County Sheriff's Office in partnership with local law enforcement, and we disposed over 57 tons of unused, unwanted, expired meds. And how much is 57 tons? How much? About 114, 115,000 pounds, right? Did you hear me? About 114, 115,000 pounds. That's without even trying. That's people like you bringing them to us so we can dispose of them legally, lawfully, environmentally safe. There's a lot more out there. Our job tonight is to help educate you a little bit about diversion as well so they don't end up somewhere else. We talked about naloxone and Narcan a little bit earlier. I urge all the first responders in this county, police and fire alike, to carry Narcan and naloxone. It is a life-saving antidote. It works every single day across this county. There are dozens of saves, either in the emergency rooms, administered by paramedics, police officers, firefighters out in the field. All of our sheriff's deputies in Hennepin County carry it. Many of our law enforcement agencies and/or their fire departments, all of them across Hennepin County, have access to it as well. That's a significant policy change and something that really helps. All right, Mike, we're going to take this drug awareness quiz. You ready? Yes, sir. You guys ready? All right, I promise this will be easy. All right, so first one. On an average day in the United States, how many people initiate heroin use? A, B, or C? What do you think? Go ahead, sir. Okay, now I'm going to give you the answers at the end of this panel, but I've already given you many of the answers, so this should be easy for you. The second one, which drugs are responsible for the most overdose deaths in the United States? Crystal meth, cocaine, or opioids, painkillers, and heroin? Which one? A, B, or C? And there is no D, all of the above. Where do most teens obtain the pills they use to get high? They get them from drug dealers they meet on social media? They get them from other students with prescriptions who sell them? Or do they get them from their parents and or grandparents? A, B, or C? What do you think? Yeah, you know the right answer. Okay, next one. 1 in 5 teenagers in Minnesota have used prescription medication for recreational purposes. True or false? What do you think? I bet if we had a couple young people up here, a couple of teenagers, they'd tell us a lot, right? Parents? Yeah? So I learned most of the stuff about what's going on from my own kids. All right, next one. 75% of current heroin users started with prescription pills. True or false? Well, she just gave you the answer. Good job. Okay, so I introduced our panel. You care which order we start? I'll let you guys decide. Each of them have, about 5 minutes or so. They want to talk about it from their perspective. Please introduce yourself again and what you do. Now make it easy for these folks because you're going to inspire questions from them in an interactive piece back and forth. Okay?
Thank you all for being here tonight. I'm Mike Hersey. I'm the Chief of Police of St. Louis Park. I guess my role here is to just give you a little background on the local impact we've seen in the opioid crisis. Over the last 5 years, we've looked at our numbers on overdoses, and it's steadily increasing over the last 5 years here in St. Louis Park. We measure that in all types of overdoses, being it with pills or illicit drug use. But there's been a steady increase over that last 5 years. We've also tragically seen an increase in the number of overdose deaths that have increased over the last 5 years. In 2017, we had 6 overdose deaths in St. Louis Park. It's really changed how we look at responding to drug calls and how we deal with youth in our community. As the sheriff explained, we're taking some steps with initiating the use of naloxone, Narcan, We have that in all of our fire department personnel and our police department personnel are trained in the use of that, and it's carried by our fire department, who responds to all of our medicals. And the Datira bags, which are available here tonight, our police and fire department also have those available to any of the St. Louis Park citizens. If they want to dispose of pills, they can stop by our police department or fire department and pick up one of those bags. And we also worked with the drug take-back program, and we had over 230 pounds of pills and other medications that were brought to our police department back, I think it was in the end of November, or was the last take-back program. But so we're seeing that there's a need for all of these prevention techniques to be used in our city, and the impact, obviously, with 6 deaths in our city is tragic. And another impact we're seeing is because of those 6 overdose deaths, we're kind of having to shift our investigation resources from both as our drug task force group and our investigators here at St. Louis Park. We're shifting away from other crimes in order to have to investigate these deaths. And we're very aggressive at that, and with the help of the Hennepin County Attorney's Office, being aggressive in investigating these deaths and tracking back the supplier of the illegal drugs, we've been successful in charging 4 people with third-degree murder on these cases, out of these 6 cases we've had last year. We've got also a couple of pending cases that are still under investigation, and we're working with the County Attorney's Office on that. So, sure.
My name is Andy Dunn. I'm an assistant United States attorney. I'm a federal prosecutor, and I just want to tell you a little bit about our office and then how we're responding to the opioid crisis. Our office is comprised of about 40 prosecutors. Those 40 prosecutors are broken up into 4 sections. There's the organized crime narcotics section. I'm the chief of that section. We do guns, gangs, and narcotic prosecutions for the entire state of Minnesota. Last I looked, there were 87 counties, 87 county attorneys, and those 10 prosecutors do guns, gangs, and drugs for all 87 counties. Because of that, we've got to be selective about what we take in. We can't take in everything. And so the factors that we look at to see whether or not it's a federal level case are several factors. One, are the targets of the investigation repeat violent offenders who didn't get it maybe their first or second time around and they need their attention focused? We'll welcome them to the federal family and the Federal Bureau of Prisons. If it's a large quantity of narcotics, it usually makes it to the federal level. For example, last week we charged a case that 150 pounds of methamphetamine were interdicted in Oklahoma, destined for St. Paul, Minnesota. We took off that load. The people came to Minnesota, and we've prosecuted about 10 people who are associated with that, and it's got tentacles into Mexico. So large quantity of narcotics. Organizations. We try to focus on organizations rather than one defendant, one-offs. And that way, if we focus on organizations, we can try to have more impact on a community by dismantling that organization. And that's why the 4th thing we look at is their interstate or international ties, possibilities to an investigation that extend outside of Minnesota, that we can work up the chain of distribution and hopefully target the source of supply of narcotics that are usually out of Minnesota, usually out of the United States, and oftentimes coming from Mexico. Now, how does that tie into the opioid crisis? Because none of those factors really tick off what's happening with opioid heroin problems. Well, in November of 2017, the Attorney General announced an increased effort to combat the opioid epidemic. And there were 3 parts of his announcement. One was he dedicated $12 million in COPS grant grant funding to local law enforcement to fund efforts such as this and investigations into the opioid crisis. Number two, he has tasked all U.S. Attorney's Office to review their prosecution intake guidelines so that cases that normally wouldn't get accepted for federal prosecution because it didn't reach any of those 4 things that I talked about, we're going to start prosecuting. And number 3, each office was directed to name an opioid coordinator, happens to be me, to develop an anti-opioid strategy. And part of that strategy is prevention, treatment, community outreach, and enforcement. Since I'm a prosecutor, the enforcement part is what I like to do. And that's working with state, local, and tribal law enforcement to pair them up with federal law enforcement to find where's the best case, the best place for their cases. Rich Peterson from DEA is in the audience, and we work quite a bit with DEA in pairing them up with local law enforcement to see what opioid cases, what heroin cases, what fentanyl cases, and Steve's going to talk about fentanyl. It is a danger. It's causing deaths. What cases can come to the federal level? The last thing I'm going to leave you with, and then I'll let Steve talk. You know, I've been a federal prosecutor since 1989. That's why my hair is white. When I started, it was black. It's white now. All right? I've been through the crack cocaine epidemic in the 90s. I've been through the methamphetamine lab problem in the early 2000s. And then the Minnesota legislature made it hard, restricted the ability to purchase precursor chemicals like pseudoephedrine, and those clandestine labs went away, and it opened up the market for Mexican mafia methamphetamine. And we are flooded with that in Minnesota. We saw that in the 2000s up until today. Like I said, 150 pounds of methamphetamine was taken because it's an open market for the Mexican pipelines. This is the first time that I have seen public health officials, addiction and treatment experts, to play a role in trying to address the problem. We tried to prosecute our way out of the crack cocaine problem. We tried to prosecute our way out of the methamphetamine problem, and I'm here to tell you it didn't work. What we did is we put generations of people behind bars for a really long time, but the problem didn't go away. Now, any anti-drug campaign has to have enforcement, has to have prosecution as part of the solution, because you need to punish criminal activity. You need to provide deterrence so people don't engage in that criminal behavior, but you can't do it with enforcement and prosecution alone. And that's why it is heartening to me to see public health officials, treatment and addiction specialists, because they're as much part of the solution as cops and prosecutors.
Thank you. Thank you very much. My name is Dr. Steve Delici, and first of all, thank you for the invitation, and thank you for coming tonight. I wear a couple of hats. I work with Hazel and Betty Ford Foundation, which most of you, I think, are aware is a large treatment network of treatment facilities across Minnesota and the country. I have been treating patients with addiction for 17 years, both here in Minnesota and before that in Chicago. I agree, I've seen each of the epidemics come in turn, and I am heartened by the fact that we, as a nation, are coming together to talk about this more so than we have in the past. These type of community events, you all coming here for this evening to learn, to talk, to ask, That's what's going to make an impact here. And I hope that we will be able to continue this dialogue so that we're not up here talking about the next epidemic once the opioid epidemic is dealt with. Because addiction's not going anywhere. So my two hats, I am an addiction psychiatrist and I do addiction treatment. The other hat that I wear is as the assistant dean of our graduate school. So for over a decade I've been teaching counselors, nurses, medical students, and residents about addiction. And now I'm going out into the community to teach physicians how to more appropriately treat addiction, how to more appropriately treat opioid use disorders, but also how to more appropriately treat pain with different medications, because that's part of this dialogue. I guess my role tonight is as one of the treatment community to state that addiction and opioid use disorders does not discriminate. It is an equal opportunity destroyer of people's lives. I'm also the resident scientist. I'm the data hound up here. So if there's questions about treatment or the science behind addiction, I'd be happy to answer those questions. It's an illness that doesn't just affect the person who has the disease of addiction, and I use that terminology purposefully. Here in 2018, we have the science that proves that addiction is a disease, an illness, like other chronic illnesses like heart disease, hypertension, diabetes, and we need a similar approach. When you are treating chronic illnesses, you need to treat the patient, you need to treat the families, you need to treat the communities, and you need to treat society. So all of you being here is the start of that process. Families are hurting. Families are being negatively impacted and devastated by this disease, as you will hear in a moment to a much more personal degree than I can speak to. Treating, first of all, prevention is the most important, and the families are going to be key to that. Early intervention is next, because treatment works. That's the good news, is that for most people with addiction, getting the treatment and getting it early and getting sufficient treatment actually does work. There's often this attitude that treatment doesn't work and there's no hope. That's absolutely false. That's absolutely false, and we can talk more about that if you so choose. But we need to have the families as part of the treatment team. And that's why I'm heartened to see people here, and I will, with that, pass the microphone.
My name is Rotem Michael, and I'm going to stand up because I can think better on my feet. This is my boy. Adam was in the Hopkins School District, and Adam, anybody who knew my son would say two things about him. He was brilliant and he had an incredible sense of humor. He just made people laugh. Adam was a gifted student. He was an honor student. He graduated in 2016 with a 3.9 GPA, a boatload of AP credits, a black belt in karate. He did improv theater, and he struggled with anxiety and depression. Unbeknownst to us as parents, he started to use marijuana in junior high to self-medicate for his emotional pain, and then turned to pills. And in July of 2016, 18 months ago, our son was in Utah, and he called really excited to tell us that he had just enrolled in his college classes for the freshman year. He planned to study psychiatry or psychology. Hours after that phone call, we got another phone call saying he was dead. He died of a fentanyl-laced dose of heroin. He didn't know that it had fentanyl in it. And he somehow maybe it was anxiety. We don't really know. What I can tell you is my son was not a partier. He would not want to be known as the poster child. And you can go to the next picture, Mike, just to see that was how he looked right before he died. I don't look like the face of a mother whose son used heroin. And I'm here to talk about it, not because my son would want to be known for his death, but to make the case that it happens in families like yours. It happens in families like mine. My son was gifted. He had good friends. He had a good family. He had a very good life, and yet he struggled with mental health disease, and he died of a heroin overdose. And until we as parents and as a community can get up here and talk about addiction and talk about mental health, the stigma and shame will continue. And the first step is by talking about it. We've touched a little bit on the law enforcement piece, but typically we hear about people who get into, especially young people, teenagers. And I really can't speak for adults, but as a parent of a teenager who got involved, I can say it typically happens for two reasons. One is that kids get introduced to opioids accidentally because of medical prescriptions. Years ago, when someone had a root canal or wisdom teeth out, they said it's going to hurt for a while. You know, take some aspirin, stay in bed, and you'll feel better in a couple days. Now we walk out of dental procedures with a prescription for 30 Percocet or OxyContin. And while it's a very, very effective pain reliever for surgeries and things, it is something that can turn into addiction. And Dr. Delici can speak to this, but basically we don't know who's really vulnerable to opioids. It has an amazing effect on the brain. And so as parents, we need to question when our kids are prescribed a dose or a prescription of 30 Percocet. If the doctor said, I'm going to send you home with 30 doses of heroin for your kid's sprained ankle or wisdom teeth extraction, we might question it. But somehow when it's called Percocet or Vicodin or OxyContin, we say, okay, you must know what you're talking about. And we've gotten into a climate that we do everything to prevent any level of pain, which has some value, but as parents, we have to be very, very watchful of any time our kids are prescribed opioids. We have to monitor the prescription. We have to rid our house of extra drugs. That's number one. Number two is that mental health issues go hand in hand with substance abuse. The CDC says that 1 in 5 kids across the country right now are struggling with a mental health disorder that requires treatment. 9 out of 10 adults who struggle with addiction have co-occurring mental health problems. They go hand in hand. And my husband and I didn't pay enough attention to our son's emotional pain of anxiety, and that's what led him to use drugs, marijuana, and then pills. So we talk about 2 ways in, and we have to deal with the entry issue to be able to solve the problem. We have to deal with controlling the number of times our kids are exposed to opiates through prescriptions, and we have to deal with the mental health piece. The Surgeon General of the United States in the 60s, some of you are old enough to remember the 60s, did a report on tobacco use. And that was really instrumental in changing the culture and attitudes about tobacco. And in the 1980s, they came out with a report on HIV/AIDS and said, and it wasn't until we started to look at HIV and said, it's not those bad people doing bad behaviors, it can happen to anybody. And until we realized that HIV could happen in a family like ours or to our sister with a blood infusion or whatever, we didn't really solve the problem. And now the Surgeon General has come out with a report that says substance abuse is a pediatric disease. And that's significant because number one, it's a disease, and number two, it's a pediatric thing that we all as parents, as educators, have to deal with in the same way we deal with immunizations for our kids, in the same way we talk about stranger danger when they're little. We have to address substance abuse as a risk that every family is going to face. When 1 in 5 kids has a mental health issue and makes them vulnerable to substance abuse, odds are if your kids are safe, they know somebody who isn't. Odds are they're getting exposed to somebody who is using drugs or intoxicated or talking about self-harm or other manifestations of mental health issues. So as parents, we have to get our head out of the sand. We have to talk about it. We have to be willing to address it as aggressively as we deal with the other threats to our kids' safety. We have to talk about it, and we have to empower our kids to have their buddies back. odds are, if your kids aren't using, they will know somebody who is. And we have to teach our kids how to have their buddies back, how to recognize alcohol poisoning, how to recognize drug overdose. More important than teaching them the Heimlich maneuver, teach your kid how to recognize overdose symptoms so that they know, with Steve's law that protects them from prosecution, they know what to do if they witness it. They know it's okay. It's not ratting on a friend, it's helping. And we've got to, as parents, be much more aggressive and assertive in taking these steps if we're going to protect our kids. I would give anything to protect my son. It's too late for me, but it happened in a family like mine. I'm involved in the Hopkins One Voice Coalition. I'm going to introduce Holly because I think each of us has a role, not just in keeping our kids safe, but keeping their friends safe. The week of my son's funeral in July of 2016, there were 14 individuals who came up to us after the funeral to say, this is happening to my son, it's happening to my neighbor, it's happening to my grandson. It is out there to such an extreme, and I know I'm preaching to the choir because if it didn't mean something to you, you wouldn't have come out tonight. But I'm urging you to take a more aggressive stance with your kids and talk about it because it is on their minds, whether you like it or not.
Thank you, Rhoda. My name is Holly Magdance, and I coordinate the Hopkins One Voice Community Coalition. I have the very humble honor to work very closely with Rhoda. She is a tremendous leader in our advocacy work and outreach to parents. So Hopkins One Voice is a community coalition, so I'm actually office just down Highway 7 next door here at Eisenhower Community Center. And I'm here to talk more upstream about some of the early prevention work that we're doing, in our case at Hopkins, but a lot of the strategies that we do could be implemented and are being implemented in other communities as well. Our coalition's been around for about 20 years. We serve the entire Hopkins Schools community. So my work is primarily focused around grades K through 12. I'm actually housed and fiscally housed out of community education. So while I work for the schools, I also work for the community, and that allows a great amount of agency and flexibility in terms of the outreach we're able to do, and we work greatly across the district as well. A couple key points that I would just highlight, again with Rhoda. We speak quite a bit about the need for prevention because of exactly what you said, that addiction is a pediatric disease. The earlier a young person begins using alcohol or other drugs, the more likely they are to develop dependencies. One thing we haven't really talked about tonight is the fact that the teen brain is in active development really until about the mid-20s. So when a person is 15 or 16 or 18 even 20, their brain is still really actively developing. And the impacts of alcohol and other drugs are more harmful, and that increases the risk of addiction. So that really points to the need for prevention, for resources, for funding for prevention. As Rhoda mentioned, there's a lot of associations between mental health and substance use. I would say in my work with the coalition, my background is in public health, honestly, I'd say more than 50% of our time is spent addressing mental health needs of our students because they are progressing. So as Rhoda mentioned, the CDC came out with a report that 1 in 5 kids struggle with a mental health disorder. On a more local level, we have a really important surveillance or survey tool called the Minnesota Student Survey. And one of the reasons that we're talking so much about mental health is that we know both locally in our own communities, in our own state, and across the country that mental health concerns are really increasing in prevalence. So we have to be talking about that. Part of my job is to administer the Minnesota Student Survey for Hopkins. And I'm gonna talk a little bit about that. But here I just wanted to kind of highlight a couple tools that we use in our coalition in terms of prevention that hopefully you can think about. I'm happy to answer questions afterwards. But again, the Minnesota Student Survey is a state tool. It is a census-style survey, meaning that every school district in the state is invited to participate. Because of that fact that it's a census survey, we have a huge sample size. It's very representative of what our communities look like across the state. In the last survey, which was in 2016, we saw a really big increase in mental health concerns with our kids, and the survey just surveys 5th, 8th, 9th, and 11th graders. At Hopkins, we saw for 11th graders, almost 1 in 3 students were reporting a long-term mental health, behavioral, or emotional health concern. That rate almost doubled from 3 years before. So this is something that's happening. It's part of the equation. We don't know why it's happening, but we do know it's happening. The reason I wanted to bring up the Minnesota Student Survey is because I feel like having data, and again, this is information that students are reporting in an anonymous and confidential manner. It helps us understand what's going on in their lives, what they're struggling with, and also what's going well. So in our prevention work as well, we don't just talk about the risk factors, what's going, the really scary things. We can also talk about what's going very well and what's working in terms of bolstering protective factors, because we know that the more protective factors a young person has, the less likely also they will be to use substances. So going back to the protective factor piece, actually in that Minnesota Student Survey, we can go in and look at what are some of the risk factors and protective factors. We know mental health is a risk factor, but in terms of protective factors, parents are a really, really strong protective factor. So students who think that their parents would disagree with them using alcohol, marijuana, or other drugs are much less likely to actually use them. So a point to get out to the community is that as parents, if you can talk to your kids, and we say don't just have one conversation, talk about it all the time. There's a lot of excellent resources we can point you to start those conversations, but talk to kids about your expectations and why you think that using alcohol or other drugs at their age would be harmful. The other part too, to just kind of give a shout out to schools, is that we also know from the survey that schools are a really important protective factor in young people. So prevention is actually happening all the time. Sometimes we don't even know it's prevention, but if kids think that their teachers care about them, if they enjoy going to school, if they think their school is safe, if they think that just general adults in the community care about them, they're also much less likely to use substances. And we've kind of cross-analyzed the data in a lot of different ways, and we have found this as a strong protective factor. So we like to get that information out to teachers and school staff because they might not think that they're doing substance use prevention just by being an awesome teacher, but in fact, they are. And finally, I wanted to kind of end on buy-in and collaboration. Buy-in, I think, is absolutely critical to having effective prevention work because if people don't think it's a problem or they don't think it can happen to them, it's really, really hard to get them behind talking about it and making change. So in terms of buy-in with our coalition, when working with kids and primarily teens, I think having buy-in in terms of having as many student-driven, peer-to-peer message type of prevention strategies is what we found to be the most effective. And I can certainly answer questions about that later, but having students be empowered and educated about what's going on and potential harms, risks, and choices they can make has been very effective for us. In terms of parents, as Rhoda mentioned, I think that denial and stigma are always barriers that we're working on, and the more that we can work together at parents and start with where they're at and have open conversation and dialogue and have a two-way dialogue, the more I think we can work together. And in staff, the more that we can do staff trainings, professional development opportunities in the schools to help staff understand what's happening in terms of addiction, substance use, mental health, the more better equipped the staff are to address those issues as well. And then finally, collaboration. I think that that's the number one most important part about our prevention work is working together. We are so much stronger working together than we are in our own silos. In the community kind of coalition world, we work across sectors. Here we're working across sectors. You can see that all of you are such an important part of our work. And I just want to end on that. Thank you.
So my name is Jeff Vaness. I'm an FBI agent here in Minneapolis, and one of the things that I oversee is our community outreach effort. And I agree with everything that Holly and Rhoda talked about on the prevention side, that it's a collaborative process. Opioids are different, strikingly different, and many in our community don't realize that. And so one of the challenges for us is how do we get that messaging into schools where kids need to hear it most, because if your kids are like mine, they turn the volume down on anyone over 40 years old. And so they're not going to listen. And so how do we bring that message to students who need to hear it most, 11, 12, 13 years old, during the formative years when they're making these decisions and may not understand that using an opioid for the first time could be addictive, could be highly addictive. And so one of the things that the FBI has done in conjunction with the DEA is we've put together a film called Chasing the Dragon. It's a documentary. Could I just see a show of hands? How many of you have heard of Chasing the Dragon? Okay, a couple, quite a few. And so it's posted on FBI.gov, and there is a discussion guide that goes along with it. And so we have this wonderful resource. It's been available nationwide. And one of the things that we've done here in Minnesota is we've partnered with, initially with the Minnetonka Police Department, the Minnetonka School District, Hennepin County Drug Court, and the DEA, and we've brought this pilot program into an 8th grade classroom. And it's really a three-part program. So you ask yourself, what does that conversation look like in a classroom setting? You know, is it a health teacher who's saying, don't do drugs, drugs are bad, right? I mean, so we've heard that, and it's for us, in the pilot program, we ask the students to watch the film. It's about 45 minutes long, and it profiles 5 young people who each detail their spiral into addiction, and they each have different pathways into addiction. And most started using either alcohol, marijuana, age 11, 12, and so an 8th grade classroom is about the right place to start sending that message. Once the students have watched the film, then we convene a panel of folks to engage the students, you know, really in small groups and one-on-one. And on that panel, we have a young person who is in recovery. Some have gone to the very school that they are, classroom that they are sitting in talking to these students, talking about what they didn't know at the time, what they didn't understand, and how their life unfolded once they made some of these decisions. You know, we have frequently on the panel, we'll have a parent who lost a child who can talk about their struggles and how they did not have an appreciation for the addiction that their child was struggling. And it's really hitting that theme of disappointment to family that we heard about with the survey and implications to others. And then we'll have somebody from law enforcement on the panel who can talk about lifestyles of individuals that have come into contact with law enforcement who had spiraled in addiction, so that our students will understand what the likely outcome will be if not interrupted in some way. And so I can tell you, having watched a number of these panels, it's very, very impactful. It's very emotional. You know, frequently, we'll have students who are in tears or need to speak to a counselor because it's that powerful. We're talking about, you know, death of very, very young folks. And so following the panel discussion, then we will open it up for a classroom conversation. And we've done this pilot in Minnetonka. We're in the Bloomington schools right now. And we're looking forward in the fall to roll this out here in the metro and then statewide. And so that's our contribution, is to get this message into the classroom that opioids are different. This drug will kill you.
Okay, we're going to open it up for questions and answers right now. And segueing in for what Special Agent Vaness just said, to Dr. Delici, what is it about opioids that are different? What makes them so much more addicting than other substances?
Sure, absolutely. So any substance that is going to be a drug of abuse has to first and foremost cross the blood-brain barrier to get into our brain. And the opioids for that are not different. That's going to be the same for alcohol, meth, cocaine, marijuana, nicotine, and the opioids. Once in the brain, all drugs of abuse hijack what's called the reward pathway in our brain. All of us have an area in the brain that will be triggered when something happens that is rewarding to us. Going out with your good friends, that will trigger the reward pathway. Having a loving relationship with another person, increases the reward pathway. Doing well on an exam increases the reward pathway. None of that increases the reward pathway activity like a drug of abuse. They all completely overwhelm that part of the brain, and in a very real sense, that area of the brain is saying whatever you just did, whatever just happened right then, is the most important thing for your survival. And the drugs do that more potently than any of the natural rewards that we come into contact with. Now with the opioids, they do that, and we've heard mention of heroin, and we've heard mention of fentanyl. They do that to an extreme that blows out most other drugs of abuse. Really only methamphetamine would be in that same camp in terms of how addictive they are. So it could be that on your first or second use, you now have your brain saying that substance and using that substance in the way that you just did, that's the most important thing for your survival. That's what the person's brain is now starting to say. You add to that with the opioids that they do relieve pain. They relieve physical pain, but you know what? They also relieve psychic or emotional pain. We've heard a lot from our panelists already about the interplay between mental health and addiction, and that is very, very true. And where do the opioids sit in that? They numb that psychic pain, that depression, that anxiety, that agitation, that sense that you are no good. You're numbed, you're quiet. What I hear often is the first time that I used an opioid was the first time that I ever felt, in quotes, normal. That's what I hear from my patients. Because that depression, that intense pain of the depression, or that intense pain of the anxiety, it's gone. It's gone. And so when you add those two together, that amplifies the addictive properties. I'll add one other piece that's just now finally hitting research, and people are finally looking at it, and that is that the opioids interact with another system in our brain, a hormone called oxytocin. Some of you might have heard of that. It is famously known as the hormone that is released when a mother is breastfeeding their child. And it leads to intense feelings of attachment. Well, that doesn't happen just with oxytocin. That's oxytocin plus the opioid system, which is also why it's so profoundly powerful when a woman has just given birth and is breastfeeding their newborn child. And when you use an opioid, you are flooding the system with the opioid side of that. And if there's attachment to the people you're using with or the environment that you're using with, you form that attachment as if it's a family member. And that adds to the addictive properties of these substances.
Thank you. I think we had a question here.
I have a question to you, sir. My name is Osmund Nagane, on behalf of Tasha community. Faduma Abdunor was here, and we are located at 24th and Nicollet Avenue. We have a connection, is like Sharif. We meet before, and we have a couple tourists. Increase of that, I'm asking you, what is number of to increase sellers and buyers, or is any new immigrant involved with that producing, bringing another state, or do you have any number 0 to 1? That one I'm trying to understand, or this is something continuous of like American-wise or Minnesotan-wise.
I'm not sure I followed all the whole question. Can you repeat it, please?
Yes. I want to know all those people you find past years bring him into the drugs in Minnesota or selling, is any number of the new immigrant that can be producing or bringing in outside of the country or in that market. Immigrants say like 30 years in here in Minnesota. That's what I'm trying to understand you.
I think I got it. Okay. He's wondering what's the effect of immigrants bringing drugs into the country versus non-immigrants?
At least at our level, the only immigrant population that we're seeing with narcotics trafficking, again, at the federal level, are undocumented aliens from Mexico. Primarily because there are methamphetamine pipelines right across the border. There are mega methamphetamine manufacturing labs. And those cartels need people to bring those large quantities of methamphetamine into the United States. They happen to be people who aren't here legally. They sneak in with drugs, and when they're arrested, they really don't even know how much trouble they're in. The people, the 150 pounds of methamphetamine that I told you about, there were 3 people in the truck. Only one of those people knew what they were doing. One of those people had a direct connect to Mexico. The other 2 wanted to visit Minnesota. Okay? But now they're in trouble. They had 150 pounds of methamphetamine in the truck that they were driving. And so but as far as the immigrant population, all we're seeing, primarily, it's Mexico, South America, Central America. That's on the federal level, that's all we're seeing. Now, that's not to say that the drug problem doesn't affect communities across the board. But the county attorneys, the city attorneys, the drug courts deal with street-level problems. In the U.S. Attorney's Office, it's higher up the distribution chain, and that's why we really don't see that problem.
Any other questions? Otherwise, I have cards too.
Thanks. My name's Wendy, and I do work in the treatment field. And I'm not sure how to word this, but part of the treatment for opioid addiction is medication management, your Suboxone, your methadone. What my concern is, not seeing any limits on, when you say opioid addiction, it's the same thing. I'm not seeing any limits put on the methadone, Suboxone medication management. So what we're seeing is people going on methadone, Suboxone, doing that. And sometimes I've even had people come into the treatment center where I work and say they won't let me get off. So there's high doses. A lot of them, sorry to say, are cash cows. It's very disturbing. And so what do you know of any kind of action that's being taken to start limiting and making that a true aftercare issue and not a lifelong maintenance program?
Yeah. So yes. So medication-assisted treatments are available for the use of opioid use disorders. You mentioned 2 of them, methadone and Suboxone. There's also naltrexone or Vivitrol, which is an injectable form of the medication. They're each a little bit different, and I'll try to be brief. Methadone is a full opioid. It will activate the opioid system to the maximum extent if you take enough. How it differs from heroin is that it builds up in the system more slowly and then comes out of the system more slowly. Heroin is instant on, almost instant off. And that's more addictive. That's methadone. Suboxone has a medication called buprenorphine in the medication Suboxone that is what's called a partial opioid. It does activate the opioid receptors, but never maximally. Estimates are 65 to 70% of activity of a full opioid. And then naltrexone, or the injectable medicine that's called Vivitrol, that's a medicine that blocks all of the opioid receptors. And so you take that either once a day by a pill or once a month by a shot. And the idea there is that for some individuals it reduces their cravings, and for all, it blocks response if they try to use an opiate. The problem is that fentanyl can displace naltrexone from the opioid receptor, and that's the risk of overdose, is we have these patients who are safely taking their naltrexone. They have a one-time relapse, and it's with something that's laced with fentanyl, and that overcomes the naltrexone, and then they can overdose. That's what keeps me up at night, because it also displaces Suboxone. So they're doing well on their Suboxone, and then they use fentanyl, and it doesn't go well. Now, your question is, what are we doing when we're using medication-assisted treatments? Is there the opportunity for individuals to get off the medications, or if you're on one of these medicines, are you on it for life? We don't know is the honest answer for every person. We're learning that process. The fact of the matter is that methadone has been with us for quite a long time. When used appropriately along with other treatment options, it improves people's quality of life significantly. They're able to work, they stay out of jail, they have less other medical consequences to chemical use. And so from a health policy perspective, for individuals who are not able to engage in other modes of treatment and recovery, that's something that helps them to maintain. And there's a lot of very good data for many decades in that regard. I will agree with the spirit of your question that there are individuals who are on much too high a dose who are altered, mentally altered by the medication, and are not doing anything else in terms of addressing their illness. We at Hazelden, for many, many years, would not use anything other than naltrexone. So we would have people come into treatment on opioids, we would detox them off their opioids, and their two choices were don't be on anything and start to do their continuing care plan, or be on the naltrexone. The patients that were on the naltrexone, if they were highly motivated, did relatively well. Those who were on no medications did particularly poorly. And we saw case after case after case. I actually personally sat on the panel that had to review the cases where people relapsed shortly after leaving treatment. I had to sit with parents who had lost their child after being at treatment with me. And we started to look at the evidence. What works? What do we need to do to address this? And our way of addressing it is that we have now incorporated Suboxone as another treatment modality. In our continuum of care, we continue to work with the patients all along the time that they're on the Suboxone. They're living in sober living, they're going to 12-step meetings, they have specialized opiate support groups. They are able to stay with their own continuing care group for as long as they want, and then we work with them month by month to see how are they doing, where are they at in their stability, and is this an appropriate time to consider tapering their Suboxone. For some individuals, that has worked. For others, it has not. And I think that one of the things that I would inject into this discussion is that we have not differentiated severity of illness very well. If we think of people with cancer, pretty much all of us know that if there's a diagnosis of cancer, is it stage 1, is it stage 2, is it stage 3, is it stage 4? And we know what that means at a public level. We don't talk about that with addiction. It's that you have addiction. And there are different severities of addiction, and some individuals need longer-term medication assistance along with the other treatments we know work. Other individuals don't need that same medication assistance. I would argue that that's not different than some people's diabetes needing insulin and other people's diabetes needing exercise and diet control. But it has to be that you're doing the treatment together. That when you use medication-assisted therapies, that's an intentional language because it's medication. In fact, we prefer medications in support of recovery, that we're using the medications to support the individual's recovery. And we were tired of seeing people who wanted to have recovery, wanted to be going to 12-step meetings and working with their peers, but the addiction and the cravings and the using thoughts were so intense that they were using before they could engage any of those other techniques. So,
got a quick question for Chief Hersey, and then I'll come to you. Chief, I'm wondering if you can actually speak on the dangers of fentanyl, both from an officer safety perspective, but then also just to the general public, even if they're not using.
Well, I would just say that we're seeing a lot of people that are using medically prescribed pills, both legally and illegally, to treat pain and some of the addiction things that we've talked about here tonight. But when they make that move to an illicit drug like heroin or fentanyl, the mixture is inconsistent and it can be deadly very easily. And it does create a bit of a significant danger to law enforcement because when we're exposed to those kind of things, both in the liquid and powder form, there is a danger that is presented to the officers. So we've done some ongoing training on how to prevent that danger to our officers, and it really can be dealt with pretty easily. But it is a danger to our officers when we're on scenes like that or we're dealing with those drugs. Whether it's an overdose scene or just possession kind of type exposures to us.
And has it changed the way you do business and investigations?
Yeah, I mentioned earlier the overdoses really has changed how we do business in our investigations. We're devoting resources away from our normal everyday criminal things that we investigate daily towards dealing with these overdose deaths and trying to deal with identifying who's supplying those drugs, and then it becomes a homicide investigation for us, and it does kind of tax our officers and work with our drug task force officers and our county attorneys to do that. So it does pull away from what we typically would do in our community.
If I can just talk a little bit, I also know working with DEA, FBI, and local drug task forces, I mean, exposure to fentanyl by a law enforcement officer, it can kill them, right? You got to understand, if a law enforcement officer is executing a search warrant or a traffic stop and comes into possession of a large white powdery substance, they have to field test that to figure out what they're dealing with. Is it heroin? Is it cocaine? Is it methamphetamine? What is it that this person has in their possession? And the law enforcement officer who field tests that white powdery substance, if it's fentanyl and it comes into contact with them, they can die. Which is why when law enforcement executes search warrants at a known fentanyl house, they have to wear special equipment, special clothing, gloves, everything's covered, respirators, in order to execute that search warrant. But that's if they know. Think about the hundreds of cases where law enforcement is executing a search warrant, and it's just a white powdery substance. You don't know what it is. And so they have to take precautions because what may be cocaine that they field test, okay, that's it. If it's fentanyl and they come into contact, it endangers their lives. So it causes a lot of problems for law enforcement.
Yeah, fentanyl is several orders of magnitude more potent than heroin. So when we're talking about fentanyl, we're talking about something that is much more potent than even heroin. And now there's the reports of carfentanyl on the street, and that's 100-fold more powerful. So yeah, you have to be very, very careful. Is right. Yeah.
Okay, we've got a question right here.
Thank you. Question on the prevention side of things. I recently took my 15-year-old son into the clinic for a moderate to minor injury, and upon discharge of the clinic, the doctor was prescribing a narcotic. I believe it was Percocet. He was pretty sore from having pulled a vast series of slivers out of his hands. And having a parent who was in psychiatry, I knew a little bit, enough to say, no, thank you, I think we'll just muscle through it. Easy for me to say, maybe more so than him. But the question I'm getting at is, I think it's fantastic what you guys are doing, and I'm grateful that you're here presenting this. But on the medical side of things, where we have perhaps some doctors who are so giddy about handing this stuff out, what tools or what artery do we have of prevention and education for them?
Yes.
Yeah, I'll let you respond.
It's a wonderful question, because there is no doubt that a part of this opioid epidemic that we find ourselves in societally was in part driven by something that happened in the mid-1990s, which was actually at that time it was federal agencies coming into healthcare systems and saying you need to address pain more appropriately. I was actually a chief resident at the time that this occurred, and one of my duties was I had to change all of our assessments to include an assessment on pain, even if that wasn't the reason the person was coming in. And if we didn't have that, then we got docked. And if the person said that they had pain, then you needed a pain treatment plan. The problem was, that was good. We didn't have any education on how to treat pain holistically. And so the opportunities for treatment was pain pills. At the same time, there was a letter that had come out that was a hospital-based study that suggested that if you use opioids for pain, there's a very low risk of developing addiction. We all know that's not true now, you know, in hindsight, 2020. So there was this big increase in the amount of opioids that were prescribed. Again, at the same time, the extended release, the long-acting opioids came onto the market. And we now know that starting with a long-acting opioid increases the risk of developing an opioid use disorder significantly more than if you are prescribed a immediate or short-acting opioid. The other thing that increases the risk is if the prescription is for more than 7 days. Once you get at more than 7 days, you start to see a significant increase in the risk of developing an opioid use disorder. It skyrockets at 31 days. So when you were talking about the 30-day prescription for a dental procedure, yes, that was the norm. That was putting people at considerable risk. The CDC is now saying 3-day prescription and using short acting, and then you reassess from that point forward. In terms of what's the education, at the state levels, there are states now mandating special continuing medical education training specifically on the safe prescribing of opioids. Our neighbors just across the St. Croix River in Wisconsin, that I still hold that license, I have to have continuing medical education every single year specifically on the safe prescribing of opioids. It's also something that I do. I go around and will teach predominantly primary care physicians and ER physicians on the safe prescribing habits. I think we're making progress. It's that we need to do more. Like all of us had said, we're making progress. We're doing good things. We have to do it more. We have to do it with more passion, more energy, and more together.
Okay, I think we have time for just a couple more questions.
Hi, we have a son, and he's a senior in high school here, and he started recently experimenting with kratom, which is a drug from, I think, Thailand. I know it's not.
Did you say kratom?
Kratom, right.
Yeah.
So I'm just wondering, I talked to him about it. He says he's not really anxious or depressed. You know, that's what he says. You know, he's just kind of experimenting, got it online. Yes. We're just wondering how concerned we should be.
Yes. I can take that. Actually, just this week, the FDA has released a statement that kratom or kratom, however you're going to pronounce it, is an opioid. We've known that for forever. At low doses used in seeping a tea, it has a mild stimulant effect. It would not be very helpful for someone who has anxiety. It would likely make that worse. At higher doses, it starts to become an opioid, and it's actually about 7 to 10 times more potent than morphine. So I consider it a substance that needs to be used with great care and should not be over the counter at this point.
How do you spell that?
Kratom.
I was just wondering, are there any steps being taken to stop people from obtaining gateway drugs or substances that could lead to opioid addiction?
No.
You know, I'll take a stab at that just because I've heard a number of our panelists kind of talk about that. And these are the young folks that are in recovery. And they talk about the idea of a gateway drug. And, you know, there's a lot of conversation now about legalizing marijuana and how it has therapeutic value. And of course, you know, now those types of drugs that are characterized as gateway drugs are very, very potent as compared to, say, even a decade ago. So the conversation that I've picked up on from some of these folks in recovery is that if you're with the crowd that is experimenting with drugs, you are maybe one person removed from the person that can get you hard drugs. And if you are experimenting with drugs, your judgment is impaired. And that frequently will open the door to experimentation with something they may not even realize is highly addictive. And so I think there's a debate back and forth on, you know, gateway drugs, pathways, but I think it's uncontroverted that someone who is experimenting may unwittingly expose themselves to something very dangerous.
I was also going to say that there's been some very good work done showing how tobacco and nicotine primes the teenage brain for other drug use. Nora Volkow, who's the director of the National Institutes of Drug Abuse, has written some elegant work in that regard. And so, you know, that's oftentimes not something that we talk about, tobacco, but that is, in fact, another addiction. And the stark truth is that that particular addiction is likely to be the primary cause of death for most of the people that I treat.
Okay, I think we'll have our final question, and then we'll do the results from the quiz, which I want to let everybody know you did pretty well.
It's my understanding that the heroin traffic, years ago when I was a narcotics detective, was coming out of Asia. Today it's switched, it's coming out of Mexico, basically through Chicago, up a pipeline 90-94 to the Twin Cities. Where did the carfentanil come in? Is that being manufactured illicitly down in Mexico, or is it being manufactured illicitly in the States, or is it getting it from pharmaceutical companies?
Rich, do you want to speak to it as from DEA's perspective?
Sure. Typically what we're seeing right now is the carfentanil, and the fentanyl is being manufactured in China. And it's making its way over to the United States, and we believe it's primarily being cut into the heroin down in Chicago. We're not seeing a lot of fentanyl, carfentanil-laced heroin coming out of Mexico right now.
Okay, I think we'll wrap up. Thank you, everybody, for coming. As I'm getting set, if any panelists have any final thoughts or words you'd like to share? Yeah, pins and needles, right? Okay, for our drug quiz, you got all of them. The majority of people who responded got everything right. So on an average day in the U.S., how many people initiate heroin use? Correct answer was 580. And then what drugs are responsible for the most overdose deaths in the U.S.? The correct answer is opioids. And right now I think the leading stat is for the leading cause of death for people under the age of 50 is actually overdose. Wow. It's surpassed cars. Where did most teens obtain the pills they use to get high? As the sheriff mentioned, swiping from medicine cabinets, so from parents and grandparents. And then 1 in 5 teenagers have used prescription drugs for recreational purposes. True. And 80%, or it actually should be 75% of current heroin users started with prescription pills. Also true. So that concludes us for the evening. I encourage you all, as you're on your way out, stop by the display tables, get some literature. The Rummler Hope Network is out there. We'll all be around for a little while. If you have any questions, please engage us. And I just want to thank you all for coming out, and stay tuned. HennepinSheriff.org for the website for the Overdose Campaign, but all of our experts, and I'd like to thank them for their time and your attendance.